Welcome, everyone. This is the long promised spot overview, and this is a San Mateo County Health program for reporting cases of COVID, and it is actually coming from the state. So I'm not going to say anything else. I'm going to turn it over to Candace Hill, who is our school nurse liaison. If you haven't met her yet, this will be your opportunity to do that. And she's the person, as Jeannie was last year, who can help you kind of problem solve and work through cases that might be a little tricky and gray. So Candace, it's all yours.
Awesome. Good morning, everyone. I want to thank you all for coming today. My name is Candace Hill, and as Patricia said, I am the public health nurse and school liaison at San Mateo County Health. So it's nice to meet you all. The goal of this presentation is to provide an overview of SPOT, otherwise known as School Portal for Outbreak Tracking. I'm new to this role, but I've been learning a lot about SPOT over the past few weeks. I hope that I can assist in a basic understanding of SPOT as well as best practices with regards to reporting information to San Mateo County Health, so things run smoothly for everyone this school year. So on the agenda of this presentation, we will review the basic SPOT systems. We have Nurse Heidi Flagg, who has kindly agreed to share her experience working with SPOT in her district and to provide a liaison perspective. We will also review best practices and then open the floor for question and answers. Again, we're all sort of learning this process, so if we don't have the answer today, we'll try our best to get back with you. And please, please, please provide feedback if you would like. So an introduction to SPOT. This program was created to help improve information sharing and contact tracing efforts between schools and health departments using the already established CalConnect system. It's looking to basically improve the collaborative efforts between schools and the health departments, which is us. And there's a big emphasis on working with the liaisons because you guys are aware of so many important nuances and details that really, really help our contact tracing efforts. So in SPOT, the liaisons have the ability to collect information during the investigation and then upload it into the portal to assist us. The SPOT intake form is used to notify us of an exposure and to initiate investigation efforts. And we'll talk about that more later. So the benefits to using SPOT. In general, it's a fairly straightforward reporting electronic system. You have the ability to easily add corrections to submitted records. And you also have the option to export data reports in the form of Microsoft or Excel spreadsheets. And then cases and contacts are automatically grouped by liaisons in schools, which most people find to be super helpful. So there are a lot of benefits on your end. So we will watch a 6-minute video that gives us an overview of basic SPOT concepts, which I will play right now.
Welcome to SPOT, the school portal for outbreak tracking. SPOT supports efforts to safely reopen California schools and accelerate contact tracing efforts by facilitating collaboration and sharing of information between schools and their local health departments, LHDs, through CalConnect, California's public health contact tracing and data management system. SPOT is a secure system for school liaisons to easily enter key information about individuals who are involved in a COVID-19 exposure, also referred to as an exposure event at their schools. Once recorded in SPOT, this information is sent to CalConnect, where an investigator from the local health department will review the information and then use it to initiate important contact tracing efforts. As a SPOT user, you can view exposure events at your schools, enter information about cases and contacts involved in an exposure, export SPOT data, and view dashboards of information in SPOT. To get started using SPOT, open the account setup email you received after talking to your local health department. This email contains a link that will allow you to set your SPOT password. It also contains your SPOT username and a link to SPOT that you can bookmark to come back to in the future. Click the link in the email and set your SPOT password. Then log into SPOT with that password and the username contained in the email. Once you've logged in, you'll see the homepage. Here you can see an overview of SPOT and buttons taking you to the main sections of SPOT. First, there's View Exposure Events. Navigate to this section by clicking the View Exposure Events button on the home page or the link at the top of any page. In this section, you can view all exposure events at all schools that you're associated to. Exposure events are used to track the spread of COVID-19 between multiple individuals in one space at a certain point in time. You will need to know the exposure event record number in order to enter information in Spot about individuals who are involved in a COVID-19 exposure at one of your schools. Take note of the status of exposure event column. If an exposure event is in closed status, you will not be able to enter information related to that exposure. To view more details about a specific exposure event, click the number in the exposure event column. To go back, use the back button on your browser or simply click View Exposure Events. The next section is Enter Information for an Existing Exposure. In this section, you can complete a form with key information about individuals who are involved in a COVID-19 exposure at one of your schools. You can also view all information entered in Spot for one of your schools. To enter in new information about an individual involved in an exposure at one of your schools, select the New button on the right-hand side of the page. Select the radio button according to whether the individual is a COVID-19 case, someone who has tested positive for COVID-19, or a COVID-19 contact, anyone the case has come in close contact within 6 feet for a cumulative 15 minutes or more, 2 days prior to symptoms beginning, or 2 days prior to test date if no symptoms. Note that the information collected for cases and contacts will be slightly different. Click Next. In the Exposure Event field, enter the exposure event number provided to you by the local health department or select it from the menu that opens. On the rest of the form, enter information for the individual. Required fields are marked with a red asterisk. Your local health department may also ask you to complete specific fields that may not be required on the form. If you have lab result information about an individual, you can include those details. Once finished, if you have more individuals you would like to enter, click Save and New to open a new form. If you are finished entering individuals altogether, click Save. You can always come back to the Enter Information for an Existing Exposure section and add additional people. After clicking Save, you will see a summary view of the last form you completed. Click Enter Information for an Existing Exposure to return to the list of all information entered in Spot. This list will show you information that you or other liaisons have entered. If you need to send an update or correct data for an individual, do not submit a new case or contact entry form. Instead, click the number in the Spot Case and Contact Number column next to the individual's name. Then click the Send Update button. A form will open where you can leave a comment about the update. For example, you entered their phone number incorrectly, or the individual recently had a positive test result. Once you're finished, click Save. To view all updates for this individual, click the related link below. The next section is Export Data. In this section, you can download and export of data entered in Spot in CSV format. You have the option to download data based on location, exposure event, only your data, or all data entered in Spot for locations you're associated to. The next section is Summary Dashboard. In this section, you can view summary data about information entered in Spot for your schools. You can see the total number of cases and contacts grouped by exposure event, cases and contacts grouped by the liaison who entered them, and cases and contacts grouped by their school affiliation. The last section is additional support. This section includes answers to frequently asked questions and a link to this YouTube video. Welcome to Spot.
All right. So just to review the initial process for everyone, an exposure occurs at a school setting. The school liaison creates and submits an intake form. The liaison account is created. And once the account is created, the liaison can go into Spot and submit any pertinent details about the exposure event. So the intake form. Think of the intake form as sort of the big picture initial report to initiate follow-up. As a reminder, anyone can submit this form through the website. You don't need an account. We ask that you try to submit this as soon as possible once you have identified a case. If you still need time to gather more information, just make sure that you just have the required information and submit it first, even because we rather you do that than have a delay in the process. Again, you can always add more information later. But obviously the key information to include is all the fields with the red asterisks, plus adding any available details in the notes section. So the location, area or groups affected, whether exposures were masked or not, and steps that the school is already taking. So just to be clear about the difference between the intake form and the spot portal and how they relate to one another, the intake form does not require username or password. It is where we put basic information about an exposure. And once we review that information, you will be given the login information to get into the spot portal. That is where you can enter more specific information about the individual case or contact. And a CalConnect record is going to be automatically generated. Even though Spot works with CalConnect, it technically isn't CalConnect. So you will have access to the Spot portal, but not CalConnect, but they are integrated together. The liaison account, once an intake form has been sent, you're going to wait for the contact tracer to create a new exposure event. Subsequent cases will link to the exposure event that correspond to the correct site, as long as the exposure event has not been closed. And again, that would be after 14 days of no positive cases. If exposure event has been closed or a case is a new location, you will need to submit a new intake form. If you are a new user, a user account will need to be created by a San Mateo County Health representative after you complete the intake. You will receive an email within 24 hours with the exposure event number. And then you can start to submit case reports to the portal and add any additional information. So our protocol right now is that there will be only one exposure event per school at a time, unless an EPI link is established with the contact tracer. So as a reminder, if it's been 14 days with no new cases, you would need a new intake form to trigger a new exposure event. If there's a compelling reason that we need to have more than one exposure event open at a time, we will send you clear instructions about what to do. So instead of making a new exposure event per classroom or confirm EPI links, we're going to have one exposure event per school. And now I'm going to give the microphone to Heidi, who's going to give her perspective of working with Spot, as well as the liaison perspective.
Thank you, Candace. Yeah, so the video was actually really great. That's really what it pretty much looks like in there. It's very easy to complete, and it's kind of like your new line list, basically. I find that it has a lot more pertinent information, like for the contact tracers versus where the line list was a lot of like symptoms and things like that. But the spot reporting is a lot easier to include information of like close contacts, what days were they on campus, what type of exposure, things like that. And it's super easy to add updates, send documents like school schedules and things like that. So if you want to go to the next one. So this is what it looks like basically when you log into your Spot portal, and then you can see right there on the left, it's where it says submit a Spot intake form. So if you have a new location or a new site, I see Anne in the chat was asking, what do you mean with a new location? Like for me, I'm a high school district, so I have multiple high school sites, but maybe for elementary schools or, you know, smaller schools, if you just have the one school site, you only need to submit one intake form and it basically links to your site. And then if you click on the other one right there on the right where it says access the Spot portal, this brings us into the next one. So you can submit the Spot intake form from the outside link. You don't have to have a Spot portal, but if you also are already signed up, you can submit the intake form from there as well. So then once you're in here, this is kind of what your view looks like as the liaison, and you can view your existing exposure events. It will show you everything that's open or closed, and that is what the exposure event basically links to your site. So you'll see from the intake form, it asks you for your location and the information for your liaison, and that's all going to link to your site of exposure basically. So for me, I'm high school, I have lots of different sites open, so they're different exposure events because they are more separated, but that might not be applicable kind of to everybody. And then when you click on the enter information for an existing exposure, that's going to bring you into like your case information and all that. So here's what we're talking about kind of with the exposure events linking to the location themselves. And then you can see like the start date of them. And then these are all ones that have been closed. So then if I had a new exposure at that same site, I would need to go in and create a new intake form because this one has been closed. And then the next view is the spot case information. And then that's going to show you all the details of that form she was showing you how to fill out of the actual case. And again, you can see where the location, it's going to link to the school site. And when you click on in the spot number, the case number, it's going to bring up all of the information from your form that you submitted. And then here over in the right, you can see where you can create a new exposure. So if you have an open exposure event, like say I have one open at Carlmont, then I would just go in and I would just hit new and enter all of the information for my new case instead of submitting a new intake form. It takes a little bit of kind of getting used to the two, but once you start using it, it gets a little bit easier and user-friendly. And then here, like I said, when you click on into the case, you can see all of the information that you've entered. This is all your case information like she was showing you. And then you can see over in the right-hand corner, once this is submitted, you can just easily send an update. And when you click on that, it brings you to another form. On the video, it only showed you able to add comments, but in this version, you can upload documents. So we upload like our school schedules and we send important information such as if there's any epi linkage, how many of our students are on what type of quarantine, how many have been fully vaccinated and what the timelines are and stuff like that. Because there isn't really a place for that in the form itself. So if you feel like there's something missing or information that you haven't been able to give your contact tracer, you can always just send them the update in there.
Thank you, Heidi. So now we're going to talk about best practices to make things go smoothly on both ends. Here. So once a case has been submitted and linked to an exposure event, there's an option to upload information. Each time a new case is identified by the school, you want to make sure that you are including specific details that I talked about earlier. So the location, the area, the group affected, whether they were masked or unmasked, and the steps that the school is already taking. And then for those exposed, it's good to know whether they were vaccinated or not, how many were exposed, and as well as any lab results, seating charts, rosters, demographic information, that is all relevant. So taking time to submit this information will greatly assist with our case investigation efforts. When you are initially setting up your liaison account, make sure to include your first name, last name, email address, and phone number in the intake form. Like we stated earlier, you'll get an email with your login within 24 hours. We also have the option to create multiple liaison accounts for each school if needed, but make sure to include the required information, as I stated above, for every person, so we know who needs the liaison accounts. And lastly, if there's like a change in a liaison, say they retire or they're on extended leave, and then you've replaced that liaison with someone else. Once there's an exposure, you're gonna submit obviously the intake form and make a note that you are the new liaison for this school, so we are aware of that. Lastly, the timeline. So submit your intake form as soon as possible, as we said. Even if you're still gathering more details, just make sure you get it in so we can start the process. Ideally have obviously the key information in, and expect that exposure event number within 24 hours. Your point of contact will reach out to you by email or phone for a quick check-in to resolve any questions or make sure you're on the same page. But keep in mind, obviously, there's a high volume of calls coming in and intake forms. So please make sure that you prioritize putting any specific or urgent questions or needs in the intake form so we can triage appropriately. And so we are looking forward to rolling out the SPOTS system for this school year. We encourage everyone starting on Monday, if there is an exposure to report, to utilize the SPOT process by sending us an intake form, and we will get the process going. Thank you all for listening to the presentation. And now I just want to open the floor for any questions that you may have.
Candace, that was an amazing presentation. I learned a lot. Thank you. Very helpful.
Thank you.
We do have several questions. I could kind of read them, and then we could also, so Anne had some questions in the chat, and she also has her hand up now. So maybe, Anne, do you want to mute yourself and ask your question?
I'm sorry. I guess I'm using my supervisor's email or invitation. I'm not Anne. I'm Miguel. I'm the executive assistant for Aspire Public Schools. So we deal with 3 different counties, and it's been madness with SPOT. But one of my questions that came up and during the presentation was that we are allowed to use only one exposure event at a time. And it has to be at a different location. Can I get more clarity on this? It seems like it's very different from other counties.
Yes, Bonnie, did you want to speak on this?
Yeah, every county has come up with their own protocols for handling the number of exposure events. And I reached out to CDPH as well as the Accenture group that designed SPOT to ask them this question. And they said each county can come up with their own protocol for reporting exposure events. And so I think how we're going to be handling it is, open one exposure event. Well, we could do it one of 2 ways. Open one exposure event for the entire school every 14 days. And then it can be closed after there are no new cases. But the con of that is that it doesn't easily allow you or us to separate the cases by those that are linked. So probably the best method that I believe that we are going to probably go with is that it is just that, because it mimics the line list. So just open exposure event for 14 days. And even if they're not linked, and then we can go back in and then separate them out ourselves by the cases that are linked. So just consider this entering your exposures into SPOT as you're creating your line list that you would normally send to us.
Okay, yeah, sorry. Us at Aspire, we actually never got to use the line list with using SPOT since the beginning. So I'm not familiar with the line list, but for instance, we do have, since the opening of our schools, 14 cases. This 14 cases have been in very different grades. So we operate from K to 8th grade. These cohorts do not mix. So they're not the same exposure event. So we've been treating them as a separate exposure event and submitting intake forms, which, by the way, we haven't received any exposure event confirmation from contact tracers, like not for a single one. So that is a little worrisome. We did submit those 14 intake forms, yet we have not received anything, but we are treating them as separate exposure events. Should we continue doing this, or should we stop?
I think the issue is and I'm guessing here, and we'll confirm this after this call, is that we thought that we had done a soft rollout of Spot in our county to Redwood City schools. So we were not expecting to receive any Spot entries from anywhere else, and that might be the reason why you haven't heard back. As you saw the last slide in Candace's presentation was that we're going to roll it out to everybody on Monday, the 20th. But there still is, we can still go into Spot and look for your cases that you've entered, and then get back to you today.
Great, appreciate that.
How many did you say you've put in?
We have 14.
14.
Yeah.
Okay, so I think, the exposure events are attached to the physical location and not to a liaison account. So did you say Aspire has multiple schools?
Yeah, we only have one in San Mateo County. Yeah, so that's the only one we have been reporting to.
Okay.
And those 14 cases are attached to the same school.
Okay, all right. And if you prefer to enter them by, grade, instead of entering them all at once, that's perfectly fine too. I think Carly Bach is on the call. I just want to verify that with her.
Yeah, I think that should be okay. We'll work with you. We really were trying to set this up to be as easy as possible for schools, to make sure that you're not having to, do a lot of figuring out which thing to attach reports to on the back end. We're really going to work with you and try to sort that out as we go through an investigation, to make it a little bit easier to just submit information as you get it, so we can go fast, and then we can figure it out and separate out specific epi-linked groups on the back end as we identify clusters, and we can go from there. But if you have a setup that you want to work with your point of contact, and it's easier to set it up to report by grade level, we're happy to work on that with you and try to figure out a way that's easy for all of us.
Okay, thank you, guys. Can I?
I was just gonna make a
Oh,
comment too.
Miguel, go on. We have a couple more questions, or a lot more questions. So this has come up a couple times. So should people only use Spot and not try to still use the line list or the old system? Is everything completely migrated over to that?
Yeah, that's what we would like, is for everyone to use Spot. We understand that some schools might be staffed differently and don't have a school nurse, or it's only the principal that's dealing with everything. So it would be great if they would still call us, and we can get them set up on Spot, and we have this recorded. Also, they could watch the video that Candace showed on YouTube and get set up. So we'd really like people to give Spot a try. We really think, Heidi said that it's made things much easier for her to just enter the information. You can go back in and update when you have more information. That makes it really easy, cuts down on all the back and forth phone calls with the health department. And so please give it a try.
Thank you. So then, related to this, if do you just sign up when you have a case? When we originally started this, there was a flyer and people could just proactively sign up for Spot, even though there wasn't a case. What's the kind of the rule on that now?
I think my understanding, correct me if I'm wrong, Bonnie, is we are encouraging people to sign up when there's an exposure event.
And that way we can walk them through Spot and help them enter their first case into it. And that's a little bit of additional training.
Okay, and then people had asked for the link to the intake form. Did you guys pop that in the chat so people have access to that?
I can do that.
And then I know this has come up before, because sometimes people have close contacts that could be, like I saw one that was 75 to 100. So you need to enter the information for every one of those close contacts into Spot. Is that correct?
Carly, is that our expectation? I just want to double check with you.
Yeah, and that's a great question. And I must apologize in advance because I'm not going to give a firm answer right now because I know we've all been navigating this surge and this new system. So our approach to start has really been to prioritize identifying exposures and cases so that we can work through what's happening and what we're seeing at the school and really work with you to try to prevent transmission. I think down the line, there may be more interest in being able to track how many close contacts are identified and how many people are exposed so we can better identify those in transmission. But right now, we've really been prioritizing the case reporting. There's also a new tool coming out with Spot where you can do some bulk uploads that we just don't know a whole lot about it yet. We're still learning about it because I think it's rolling out maybe even today.
No, the 29th.
29th. Okay, so it's rolling out in a couple weeks, and we think that that will make this contact reporting, if there's interest in tracking contacts more closely and there's less cases and we all have a little more capacity to handle that down the line with this new tool. We just need to learn about it and see how it actually works once it rolls out. But so right now we've really been prioritizing cases and exposures. And then if we can work on close contact reporting, that's helpful so we can make sure the appropriate steps are happening and we're, helping support you through the process to prevent transmission at your school. But we know that the reporting, while we figure this all out, is more burdensome. So if we, can't achieve it right this moment, it's something we can keep working on as we go.
Okay, thank you, Carly. And then Sasha and some other people are having really specific problems. So either maybe they can circle back with an email or a call to Bonnie or Candace or Carly about some of those things, or maybe at the end of this call. There's a question, can you use this for your preschool and your kindergarten? Well, you could use it for your kindergarten, but what about your preschool students? Do you enter those in there as well, like 2, 3-year-olds, 4-year-olds?
Yeah, that should be fine. Go ahead and use the system starting Monday.
Okay, and some more difficulties using Spot. And then Jill had a question. Oh, that's a question for me. Let's see. There's some lag time. I think that I get through most of the questions that are sort of about the overall. Maybe people want to just raise their hands if they have kind of questions. Going through also with if you operate in different counties, yes, yeah. So there's these questions. Some of them seem a little specific, but why don't people just raise their hands if they have questions? I don't see anybody's really answering in the chat right now, so maybe it's just easier to have a conversation. So Misha, did you want to go, Misha?
Yeah, I'm sorry, my internet connection is a little fickle this morning. So I just want to be really clear. I can go to the spot, the link that you gave us to look at the video again, to familiarize myself, but I don't actually start the process until I actually have a positive case. Is that correct?
That is correct, yes.
Okay, thank you.
Application of the system, we don't have a great way to create an account until there's an active exposure event in the system.
Okay.
And then Mark.
Hi there. Excuse me. This is probably a good question for Bonnie or for Carly. I've been using the system as far as it will let me use it, meaning that I've used the intake form and there seems to be a lag time between when you submit that as to when a record number is created on Spot. I've had it explained by some of the contact tracers that it may take about a half an hour for somebody to review it and confirm it, but I may be missing a piece. Is there an email or a communication that comes, or is it just that we assume a certain amount of time, then we go into the portal to answer, to get the rest of that information to help the contact tracers? Because when we initially make a call to the parents, we at our district, in my high school district, we have an internal form that we've made up, which answers some of the questions. I ask the parents those questions, and then I ask the intake form questions, and then I have to close it and submit it and tell the parents I may have to call you back for more information. They may be sick, they may be irritated. Most of the time, they're very receptive to that. So is there a communication piece that I'm missing between intake form and when you can actually then go into the portal?
Candace, please feel free to chime in because I think you may have had some info earlier. So this is part of the new process we're rolling out as of Monday. We know that's been a little bit of a struggle because we were learning a lot too about what notifications automatically occur back to you when we use the system, and I don't think it's a lot of them. So starting Monday, the plan is that, you know, we will create an exposure event. We're saying within 24 hours because we want to be realistic, as you know, if we get a ton of them at the same time, we may need to prioritize, but usually it's happening much faster within, you know, a couple hours, a half hour, like you were saying. We just want to be realistic that there may be times when it'll be slower. And once it's created, starting Monday, you'll get an email back with that exposure event number once it's created. But you can also probably see it in the portal even before you get that email. So if you want to go back and check, feel free, but we are going to start sending an email with that exposure event ID as soon as it's created, so you don't have to be waiting around and checking back a bunch of times.
So
Yes.
Carly, I just want you to see, I have a smile on my face. I'm happy with the system. There's no criticism. I know that everything has to be worked through. There's glitches. I have a ticket in for that kind of thing. So you're getting nothing but smiles from me because I know that the contact tracers and you all are working very hard, and this cuts down on the back and forth. So for everybody out there, please try the spot system. I mean, as an outside the box, I'll give you a ringing endorsement. Everybody, please try it. Go through the YouTube. It helps a lot. It will work. It will help them contact trace and really get a good look at everything. So I'm happy with this, Carly and Bonnie. Thumbs up from me.
Thank you so
So
much
that-
for
Thank
saying
you,
that.
Mark.
To that point, Mark, I was going to say is that's why it's kind of important if the exposure event is linked to your school site and you don't have multiple sites open, because that way it cuts down on that lag time between the intake form and them creating the exposure event. So what I've done also is taken that intake form confirmation number, you get a spot number once you create that, and you can just email the school team. And then if you don't get it within that, you know, day or two or whatever, and then they can get back to you pretty quickly about, oh yeah, here's your exposure event, and you can go in. And I also have typed up all of the exposure event questions that are in the form, so I can share that with you too, so you have that information of like the questions to ask. It's pretty much the basic stuff of like who was in the classroom or how many people were you know, in contact with and what groups they are, but I can share that with you because I have it all typed up for my district staff.
Thank you, Heidi.
Yeah, Heidi, I was just going to ask you, so once you enter something, an intake form into Spot, how long does it generally take for you to hear back with an exposure event number? And do you get that by a phone call or email, or do you just check the system?
I think we were just checking the system. It was a little bit all over the place. I haven't had to do much reporting in the last week or so, so that's lucky on my end. But like I said, if I saw a lag time between like a day or two with, you know, the intake form and not receiving an exposure event, then I just emailed the school team real quick at the HLT, and then yeah, they would just get back to me, either call me and say, hey, your exposure event is open. And then once you see in there too, I think someone asked like, who is your contact tracer? It will give you that information of who your contact is. So if you already have, you know, those contacts to the people and you notice like, hey, you know, my exposure event's in there, or if you want to contact that person in Spot, it will tell you. And it's helpful because it tells you where they're at in the process. So there's like, it'll say awaiting outreach. So then you know, oh, that person got my exposure, but they're still working on it, you know, and it'll say like under investigation and things like that. So it does tell you once it's in there, but there is a little bit of that lag time between the intake form and then your San Mateo County Health representative creating the exposure event from that.
That's great. Thank you, Mark, and thank you, Heidi, and everyone for kind of chipping in and sort of crowdsourcing this. Appreciate it. Sasha, you've had your hand up for a little bit.
Hi, yeah, I wanted to talk a little bit about the thing that I was chatting about. We had a positive antigen followed by a negative PCR on the same day. And then I was contacted by, because the parents work with the state, they work with CDPH. I was contacted by somebody from CDPH who then brought me a new Q molecular test and had me test the child again. The child was negative. And I have had just an incredibly positive experience working with Nikki Khan, contact tracer. She has just been unbelievably amazing, just fabulous. So I have felt very taken care of. I can't get into Spot. It has literally just been like, I try every day for, I don't know how many times, and I can't get it. And she's been trying to help me. But I don't, if there's a technical number I could call just for tech support, that would be great, so that I could actually get in there and do some of this. But my question is, knowing that this child is negative, Nikki bubbled it up and was told that any positive is positive and we have to treat it as positive. I mean, that doesn't make sense to me if we know that the PCR is the gold standard and that it's saying that it's negative. And then there was a follow-up test that also said it was negative in a different format. And I tested with Binax and it was negative. But on this Case Smart, or I don't remember what it's called, Case Smart, I think. Case Start? I can't remember. Care Start? I don't remember. Anyway, that was the one it was positive on. But everything else it was negative on. So do I then, because Spot is saying we have to treat this as positive, am I supposed to be quarantining this child that we know is negative? Like, is that the protocol that I'm expected to be following? Or am I expected just to report it as positive? I need some guidance. I'm super not clear. And I'm also, then I can't get in and actually do anything. But that's another problem.
Bonnie or Candace, do you want to tackle that, or do you want me to take a shot at it?
Carly, I think you're the most knowledgeable about this type of thing. That does come up a lot, Sasha. You're not alone.
Yeah, and these situations are always so, tricky to navigate. So for the Spot piece of the question, hopefully we can get you up and running, and that'll make everything a lot easier. But I think it's always helpful to report that positive. And then I would use that functionality within Spot once we get you up and running to submit that additional information that updates if there are additional results. Part of what's happening is we're seeing that when there's so much COVID transmission in our community, when we're getting positive results, it's very likely a true positive.
Right. Absolutely. And I get the huge number, right? And it's like, let's not do a whole analysis on every single situation, positive. I totally get that. Yeah. I totally understand the reasoning behind it. I respect it, support it. I just need to know kind of like, now what, right?
Yeah. So I think submitting that sort of info through Spot is really helpful, because if we can see what's happening, we can help navigate the specifics of the situation. And we always want to start conservative, right? If we have any doubt, if we think it may be positive, we want to be taking those steps to prevent transmission while we figure it out. So that's kind of where this positive is a positive thing is coming from, because we're just not seeing a lot of false negatives right now. False positives right now. There are some kind of those complexities around if it's a certain type of test, like an antigen test, and we're not believing the result for some reason. Then there are some complexities where we might look at a PCR as more of a confirmatory test, which is a little bit different than, a false positive, false negative sort of thing. And we might, make specific decisions based on the situation, based on what we think is happening. But that has to, that requires a really close look at, the clinical presentation, whether the person has exposures, all these different factors that kind of weigh into whether or not we think this person may truly be infectious, because the last thing we want is someone infectious at school, potentially transmitting. We really want to prevent that from happening. So if you have one of those hopefully very rare situations where you're encountering that, I would get as much info as you can into Spot and work with your point of contact. And they can always, work with us. We have a whole team here who helps support with those more complicated situations to try to figure out what we're going to do based on the specifics. But in general, a positive is a positive, unless you have one of those very rare circumstances, like it sounds like the one you're talking about, that we'll look at more closely.
Okay, so let me just to confirm what you're saying. Treat every positive as a positive, quarantine, all the steps as regular. If it is a situation where you know that there is actually a negative, make sure you make that clear to the contact tracer and let the parents know that this may change. We need to get approval, but for now, we're following the quarantine steps. Is that correct?
Yeah, and hopefully we can get a quick answer, but those PCRs in particular sometimes take a few days, so we don't want to,
Yeah.
need the info before we can really make an informed decision on those.
Right. And what I had done is I had sent the child and the sibling home, alerted the parents. We did the follow-up PCR. It came back the same day. I even informed the rest of the families that they were on modified quarantine. We did everything. Then we got the negative PCR, and I made the call then that it's not an actual case, and I let people know, but it sounds like maybe I don't have the authority to do that.
Right, that's a public health thing.
Okay.
Right. So this is a good question. So when somebody is struggling or in the moment and trying to make a decision, can they still go back to the phone number and the email address that Bonnie put in? Not does everything have to go to Spot, or can you quickly get some great consultative, services from Candace and such, just as we've done for the last couple of years? Is that still like?
Yes,
Yes,
Okay.
definitely.
we encourage that. We have a team, we triage our emails and phone calls for giving guidance and consultations. So obviously we're encouraging people to report exposures through Spot, but any other sort of questions you have, please utilize the main line as well as the school email, which I can also add in the chat, or I think Bonnie did already.
Yes.
Okay, perfect.
Thanks, guys. I appreciate that. There was a question I just saw recently. Somebody asked about Binax and worksite labs. So just a little update on that. One on Binax. County Health has many kits of Binax that are going to expire at the end of October. They would like to get them in your hands. So we will be reaching out. Jill has a survey she's going to create, I think, to kind of like send out to people. We're having a meeting with private schools and charter schools on Monday. I think we were going to talk about them, but since we have you here. So if you're interested in Binax, it's not just as simple as just, I want the kits. You do have to go through a training process in order to use them. You can't just get them and use them, but they are free and you can have them on hand. And they're very great to have when you might have a possible exposure. Then you can quickly test people on campus without sending them off somewhere, and you can get your results pretty quickly. Then Heidi said they're using worksite labs. And so that is something that the county office is also looking to use, and we have a contract with them now. So they will come on site, and there's other companies too that will do this for you. And maybe people can put in the chat the other companies they're using, if they are, who will come in, and one like worksite labs will do your contact tracing for you. I think it was like, I'm going to say around $60. Don't quote me on that. And then they will also do testing for you. And again, you don't pay them anything, and the parents don't pay them anything. They work on billing insurance for that. And so that's just another option to have. And they will do a PCR test, and I believe they will do a Binax test as well. So that's just another option for people to use for testing. And again, we will let you know more about if you're interested in Binax. Again, great to have them on hand. we have a lot and they will expire. Also, if you're already actively using them and you look at your lots and they expire in December and you want to hold on to those for a while, we can then also get you some that you can use for the next month and hold on to the ones that are expiring later. This is for the Binax now. Jill, did you have anything to add on that?
No, only that I just stepped away from the meeting for a second because we just got a whole bunch of them delivered to our office. And so for those of you who had already let me know that you were going to take some, we have it. It's here. I don't know if any of you are in the meeting, but it's all organized and ready for pickup. So, and we're already planning our next, like trying to go over to San Mateo County Health, get more and bring it. So I'm going to put my email address in case you don't know it in the chat. And if you currently have the capacity to use to use Binax, then let me know and I can hook you up. Okay, thanks.
Anyone else have questions or anything else from public health that you'd like to share? If we missed something in the chat, just let us know, raise your hand. Well, I think it was Mark's question about neuroplasticity. So I think that's our expression for today. We're all going to seek that when things are feeling really difficult and we don't know how to do them. I'm going to adopt that myself. So thank you, Mark. And if there's nothing else from anyone, we will post this recording and it'll be available. And then any of the various attachments and things people have talked about, if we can get them all, and then we'll send them out to everybody who was on this call, as well as just our private charter school, public school list.
And I just wanted to say thank you to everyone. I know you guys are working so hard. There's a lot going on. But as people have said and given us feedback, SPOT has been working very well for them. So just try to be patient with it. We are here to help you and support you this school year. So thank you guys so much.
I second that. Thank you all. And everybody who calls us is always so polite and we work together. So I really appreciate that. Thank you.
Me too. And thanks, Candace. Great presentation. And Heidi.
Yep.
Yeah, Candace, you did a great job. Thank you so much.
Yeah. Thanks, Candace. All right. Well, everybody have a great weekend. You know where to reach us. Thank you.